Assalamualaikum. Today we are going to have a lecture on diagnostic strategy in primary care. So, what is the problem when you are making diagnosis in primary care? Okay, the diagnostic problem in primary care is that in primary care, the presentations are usually by symptoms, not diagnosis. As compared to other discipline or in hospital care, in most cases, the diagnosis has been established, whether in the emergency department or the health clinics. They actually have made some differential diagnosis and provisional diagnosis, and then only they refer cases to you. So when you receive these patients, you actually have easier steps to make diagnosis, because these doctors at emergency department or primary care setting have tried to rule out other provisional diagnoses at their best. So in primary care settings, when they come with the symptoms, these symptoms can be shared with many specialties, many systems, many organs. So it is actually quite challenging to make a diagnosis in a primary care setting, where especially the facilities to help you to make diagnosis is limited. Okay, from your experience, what are the common presentations in primary care? You've been to a clinic, you've been to a hospital outpatient department. So what are the common presentations? It is quite similar to the hospital presentations, only that it is at a different spectrum of the disease. Okay? If in the hospital you see a patient admitted for chronic cough associated with other symptoms, other common presentation in primary care is cough. Others are like aches and pains, like earache, backache, headache, stomach ache. Other than that is skin problems. In primary care, we don't only see cases with acute presentation, but also we are following up patients with chronic diseases. For example, hypertension, diabetes, heart disease. And if you see, many of these chronic diseases have been transferred to the primary care setting for management. Probably you don't really see hypertension clinic or diabetes clinic specifically anymore in hospital specialty clinic. Okay. When you think about a presentation in primary care, and I mentioned just now that a presentation is shared by many other systems or specialties. Okay, think about this first example. Cough. It is very common, but when you think of what are the causes of cough, cough symptom is shared by many diseases. Do you agree? Okay. Give me an example of diseases that can present with cough. Okay. These are among the causes of cough. When you are in internal medicine posting or internal medicine specialty, Probably you will be thinking of respiratory problems when a patient comes with cough. For example, URTI, LRTI, like pneumonia, tuberculosis, asthma, lung cancer. But in primary care, you have to also think about other than respiratory causes, such as heart failure. It can be psychogenic cause. It can be ENT cause, such as postnasal drip. Second example, back pain. What causes back pain? Causes of back pain, maybe you will refer especially to orthopedic problems or orthopedic system. But in primary care, we have to think of many other causes of back pain. For example, it can be mechanical, orthopedic especially, like spondylolisthesis. We also have to think about, could it be infection that cause back pain, such as TB, abscesses, urogenital problem, prostatitis. It can also be cancer, such as metastasis. It can be congenital problem, scoliosis. It can be cardiovascular, such as ruptured aortic aneurysm. It could also be gynae problem, such as endometriosis. It can also be a hidden agenda, such as depression. So, if you notice, the diagnostic problem in primary care is that there are too many possible diagnoses for a symptom. And with this, how can you make sure that the diagnosis is correct? How to make sure that we do not make a wrong diagnosis? And how to make sure that we do not miss any serious disease? Okay, for most diagnoses, it is important for you to actually get a thorough, relevant, specific history to make a diagnosis. But the main problem in primary care is that we have very limited time and we have limited facility. I think when you go to the health clinic, then you will notice this. Roughly, a medical officer will have about 10 to 15 minutes to see a patient, as compared to in your practice, you are given half an hour to get the history from the patient, and you have half an hour to do physical examination. So our 10 to 15 minutes actually cover from history taking until management. So how do we solve this problem? So this is a model that we usually in primary care use to help us make a safe diagnosis for a patient. There are 5 questions in this basic model that you have to ask yourself. What are the answers for these 5 questions? Basically, these 5 questions are differential diagnoses to make sure that you are safe and your diagnosis is correct and you are not missing things. Okay? So the first question when you see a patient that you have to ask yourself is 1. What is the probability diagnosis in this patient? You get a short, relevant history, and then you ask yourself, with these presentations, what is is the most probable diagnosis for this patient? Okay, that is one. Number two, with these presentations or with these symptoms, what serious disorder that I should not miss in this patient? Question number three, what conditions are often missed with these presentations? This is called pitfalls. Pitfalls means that the symptoms or presentations can be missed because we don't really think of the diagnosis, because it can be an unusual presentation or a rare presentation of a disease. Number four, the fourth question that you need to ask yourself is, could this patient have one of the masquerades in medical practices? I'll go further detail on this medical masquerades. And number five is that you have to ask yourself, is this patient trying to tell me something else? Okay, for every presentation encountered in primary care, we need to ask these 5 questions so that we do not make any misdiagnosis. Okay, question 1. What is the probability diagnosis? Most of the time, this is the most common diagnosis based on the patient's background, the medical history, the physical examination, and the investigation. Okay, question 2. What serious disorder not to be missed? These usually are diseases related to, for example, cancer, HIV/AIDS, serious infection, such as meningitis, infective endocarditis, any potential suicide, any intracranial lesion, or any ectopic pregnancy. So these are among the serious disorder that you should think of so that you don't miss any serious diagnosis. Question 3. What conditions are often missed or pitfalls? This usually is based on your experience. It can be an atypical presentation of a disease. For example, headache can be caused by sinusitis. Tiredness in an elderly lady may be caused by UTI. Palpitation in a woman may be due to menopausal symptom. Question 4. Could this patient have one of the masquerades in medical practices? Doctors can be sometimes deceived by the presentations of some diseases, as I'm going to list later, due to their varieties of possible presentations. Okay, these are the 7 medical masquerades. If you read the masquerades, depression, diabetes, drugs, anemia, thyroid and other endocrine disorder, spinal dysfunction, and UTI, these diseases actually can present with many symptoms which are not specific to a system or an organ. Therefore, we need to consider these diseases when patient presents with a collections of presentations or symptoms. Okay, we'll stop now and we will continue in part 2 of this lecture.